Illinois has many laws on the books to protect abortion rights, but bills making their way through the Capitol could add more.
State Capitol reporter Theodora Coulivares has the story.
Illinois is often called a safe haven when it comes to abortion.
We don't know the outcome of the litigation yet, but there is a fear of what this might entail in terms of the treatment.
One bill making its way in the Capitol is in response to another case before the U.S. Supreme Court involving an Idaho law, allowing a patient to get an abortion if their life, not their health, is at risk. Abortion rights advocates say it could impact federal law around patients who have medical emergencies, but a bill in the Capitol aims to make sure protections remain.
We need to codify this into law because, as we know, unfortunately, we cannot trust certain situations and certain decisions that are coming out of the Supreme Court, as we saw with the Dobbs decision.
But it faced opposition from anti-abortion groups who say the federal law protects care for, quote, unborn children.
It would add confusion for hospitals and medical personnel as to whether to offer abortion when the usual prescribed medical treatment has helped pregnant women. A number of the hospitals and medical personnel may offer abortion just to avoid possible lawsuits.
Another bill involves the Lieutenant Governor's Birth Equity Initiative. It requires private insurance companies to cover services provided by doulas and midwives for pregnancy, postpartum, and newborn care.
We should be in the business of saving people's lives and not in the business of determining whether or not this person gets access to health care and this person doesn't.
It also provides abortion care coverage without limits like waiting periods or deductibles. The measure got pushback from Republicans.
Why do we think it's so wise in the state of Illinois? Granted, I've heard all about protecting reproductive rights, but you have no copay.
Reporting in Springfield, I'm Theodora Coulivares.
A third bill would prevent someone's reproductive health care records from being subject to a public records request. Local governments also wouldn't be able to take legal action against a patient or provider who gets reproductive or gender affirming care in Illinois.